What is the problem with this question? It's a very short question. I said, which of the following the caring nurse should report immediately? You see the word immediately, you underline to the healthcare provider. It's a priority question. And you said, before even you look at answer, don't try to find the answer without not understanding the main point. We have a 35-year-old female. They're always going to give you age. Sometimes they don't. Okay, with the long-standing Myasthenia gravis, this is their problem, right? And he's receiving some medication. Neostigmine. Which of the following the caring nurse should report immediately to the healthcare provider? There's something being asked. You have to report immediately. There is a case about a 35-year-old client, right? What is the case is about? About Myasthenia gravis. What is the Myasthenia gravis patient is receiving? Neostigmine. And why would the provider ask you, or the examiner ask you to report something that is abnormal based on the symptoms they've given you? They're testing your understanding of Myasthenia gravis, the treatment of the Myasthenia gravis, what you look for when you're treating Myasthenia gravis. That's all. This can be a full case, but it's made in a simple, straightforward question so that you can think about it. Before you attempt it, you got to figure out what at all is going on. What is Myasthenia gravis? What at all is that? You know, it's an autoimmune disease, right? It's a neuromuscular problem. And your body is fighting against what? Acetylcholine receptors. So this is the neuron, and this is your muscle. The muscle have acetylcholine on it, but you have antibodies attacking these acetylcholine receptors that nothing can bind to them. And therefore what? The muscle cannot work. It gets weaker. Which muscles are usually affected? That's what you have to know. That you know that the eye muscles and the muscles for swallowing, these are the ones that are commonly affected. And so they cannot function the way they're supposed to. They are very weak. The rest of the body muscle is also affected. Therefore, they cannot contract the way they're supposed to. That's all. What do they need? This is the acetylcholine, like I said. These are acetylcholine receptors. Okay, so the body needs to provide more acetylcholine to them. This is what is being destroyed by the antibodies. It's not completely destroying it, but it's competing with it. Competitive inhibitor. It's preventing it from binding to the receptor and causing the muscle to contract. Therefore, what? The only way you can overcome that is to give them more acetylcholine. You have to give them more acetylcholine for the body to work. That is the examiner is asking you. And how do you do that? You give them Neostigmine. How does Neostigmine work? Neostigmine, this Neostigmine, it just works easily. If this is acetylcholine, it's supposed to be destroyed by your body if you don't need it. There's an enzyme here, acetylcholinesterase, that destroys the acetylcholine. If you give them Neostigmine, Neostigmine come and bind to the enzyme and prevent the enzyme from breaking down acetylcholine. So what do you have? You have more of acetylcholine that cannot be broken down. Therefore, this can bind to the muscle receptors and the muscle gets stronger each day, right? You can swallow easily. Easy. That's why we give them what? Neostigmine. Then this is why this question is being asked. Critical thinking. What am I doing? I'm now giving you what? more acetylcholine than you needed. So this is the problem. Your body, now you have what? If I give you neostigmine, now you have excessive amount of acetylcholine. This is the concept of the question. You have more than what you need. So you're using it to move your muscle. You're using it for your eyes so that you don't get ptosis. You're using it so that you can swallow better. You're using it so that you can walk. But when you have excessive amount of it, what would you do? Your body said, I don't need that much of it. It's going to give you side effect of that. This is what we call cholinergic side effect. That means you have too much of what? Acetylcholine. And you already know what is acetylcholine. It's a cholinergic problem. Acetylcholine is cholinergic. That means your parasympathetic nerve is doing what it's supposed to do, right? If you don't understand, it will be opposite of sympathetic nervous system. That's opposite, right? Opposite of that. So if I give you neostigmine, I'm making you more parasympathetic. That's all. At the same time, I'm making you feel what? Better. I'm making you feel better from your Myasthenia gravis. That is what the question is asking you. I'm taking my time in explaining. But if you're taking the test, you don't have to go all the way, but you can figure out. You see the key point, Myasthenia gravis. What do you need? Neostigmine. If I give you neostigmine, you're going to feel better. Your ptosis is going to go away. Your dysphagia is going to improve. Your weakness throughout the day is going to improve. But if I see signs and symptoms related to what? Excessive acetylcholine, that is my diagnosis. And you know it already, but the board is not telling you that. The question is not telling you. If I give you too much of acetylcholine, cholinergic, what are the signs of cholinergic? You already know. I don't even have to mention them. You know it already. You know it. There are signs and symptoms that everybody know, right? You salivate easily. Urination goes up, right? Lacrimation. You make a lot of tears, right? You have diarrhea, right? You know that. So let me take this out. You have diarrhea. You know that already. I don't have to touch you. Okay? You can vomit, emesis, secretion, basically excessive secretion, because that's what it does. You start to sweat, diaphoresis. These are all signs and symptoms of cholinergic effect, excessive secretion, cholinergic effect. The worst of all, think about it. Your heart is under too stimulation. I do not like about 30% of people do not get this question right. 30 or 35%. Your heart is under sympathetic nervous system and parasympathetic. Sympathetic speed things up. Parasympathetic will lower things down. In the relaxed mode, right? Therefore, what are your answers? You can see that this question is not hard. It's test-taking strategy and thinking. I know this patient is going to have ptosis already, right? I know it's going to have ptosis already. I know they're going to have muscle weakness already. I know they have dysphagia already. This is all an expected finding. Even though dysphagia, if they have it, is a sign of airway. But remember, I'm giving the whole question is based on neostigmine. If I'm going to give you neostigmine, your dysphagia is going to improve slowly. I'm looking for opposite of neostigmine. Therefore, if I see this patient is in bradycardia, it tells me that I'm doing a cholinergic side effect. Is a cholinergic side effect. The question has nothing to do with the neostigmine, Myasthenia gravis anymore. It's related to neostigmine. If I give you neostigmine, I'm going to give you what? More acetylcholine. Your pitosis is going to improve. Your muscle weakness is going to improve. Your dysphagia is going to improve. But when I see side effect of that medication, which is bradycardia, it's because I'm stimulating you too much. It's a very good question, but I want you to think. You know, pitosis is normal for them. You know, weakness at the end of the day is normal for them. You know, dysphagia, they have a little bit of dysphagia, which is a priority. It's a priority for them. By you treating them, you're treating this patient. This, I don't expect this. I don't expect this in a myasthenia gravis patient. At the same time, if I give you neostigmine to help with your myasthenia gravis, when I see bradycardia, it tells me my medication is excessive. I can change it and I put diaphoresis. It's the same answer choice because of neostigmine. I can change it and I can put this bronchoconstriction. Remember, think about it. This is also a good one. Critical thinking. What do we give asthma patient when they're having asthma attack? What do we give them? We give them oxygen, right? We give them what? Albuterol. It's a bronchodilator. What else do we give them? Think. What else do we give asthma patient when they're having airway issue? What do we give them? Think about it. Oxygen. We give them albuterol, and steroid. We give them another one in acute asthma attack. What is another thing you give them? It's a bronchodilator. What is another name for bronchodilator? Apart from the bronchodilator, what do you give them? You give them what? What do you guys think? You give them bronchodilator, you give them steroid, you give them oxygen, and you give them one more thing. One more thing you give asthma patient in acute asthma attack. What do you guys think? You give them anticholinergic. Think about it. Anticholinergic. That means anticholinergic will dilate your bronchi and help you breathe. Cholinergic will cause what? Bronchoconstriction. So neostigmine side effect is also bronchoconstriction. Excessive production of acetylcholine can produce what? Bronchoconstriction. So I can change this. Instead of the bradycardia, I can put bronchoconstriction. It's the same question. It's a side effect of what? Cholinergic effect. Neostigmine causes bronchoconstriction because of excessive stimulation of cholinergic effect. So salivation, urination, lacrimation, diarrhea, emesis, excessive secretion, diaphoresis, and bronchoconstriction. Those are your priority that the nurse is supposed to intervene. You see one simple question, but it has a bunch of stuff in it. It requires you to think critically. And there's nothing to it. Nobody wants to make you fail, but they want you to understand the concept. Like I said, if you study and you don't understand the concept, please go back and look at it. Why am I reading this page? I don't understand what is in that page. And when you watch a video, try to get that point. If you don't see that in that question or the video you're watching and the person giving you the video is not talking about the concept underlying it, then they're just giving you facts. Facts cannot help you. Fact is just basically memorizing fact. But if you understand the fact, when you see question like that, it's easy. You go back with the fact and then understand the underlying problem, the concept within that, and then you use it to answer the question. Straightforward question. So don't be trapped with the dysphagia, the pitosis, muscle weakness. I just put it there to distract you because the question is asking about neostigmine. That's all. The question is related to neostigmine. The same question, the same idea. I've not changed anything. I just used the same topic to give you the same thing. It's a select or apply. Which of the following in the client history, you see, I'm going for the buzzword, will make the nurse question the prescription. A nurse is caring for a client prescribed trimethoprim for severe depression. What is being asked? You got to question the issue or the prescription. What is the buzzword in it? Is the trimethoprim. It's taking this medication. What is in that? You see, those two words, I'm going to focus on it. Those two words. So, patient is prescribed trimethoprim for severe depression. I've given you an idea that it's used for depression. Therefore, turn your mind somewhere and say, what are the medications used for depression? That's all. This is the way you start thinking. And one of these group of medication is given to this patient, and I need to question it if I see any of this history. Or you need to figure out what kind of class of medication is trimethoprim. Is it SSRI? Is it MAOI? Is it TCA? Those are the bigger ones. Or is SNRI? Or the atypical antidepressant? This is the way you start thinking. I know definitely this is not SSRI. It's not MOIs. If you know your pharmacology for mental health, it's not SNRI. It's a TCA. What is the biggest side effect of TCA? Is this anticholinergic effect? Okay, is this anticholinergic effect? I have an acronym for it. I call it, I'm going to teach you. It's TCA dance. Okay, they have dermatitis problem, anticholinergic, neurological, cardiac, and endocrine problem. And cardiac is number one, followed by anticholinergics. That's the biggest side effect. It's not an SSRI, it's a TCA. Therefore, if you figure out that you know that this is a TCA, and one of the side effects of TCA is what? Anticholinergic. Remember the first question we're dealing with cholinergic, anticholinergic. The first one, cholinergic effect, the easy way to remember them, if you don't know them, think of cholinergic as being wet. Most of the signs and symptoms is wet. Salivation, diarrhea, lacrimation, urination, all of them sound like you wet. Anticholinergic, you dry. So you can't salivate anymore, right? You can't lacrimate anymore. Like you get constipation. You can't pee anymore. So things are what? Dry. Therefore, you figure out the concept. I know I'm looking for something that the side effect of this medication is what? Anticholinergic. If any of these people hate anticholinergic, you can do that to them. What does Myasthenia gravis need? It need Cholinergic. It tells you it hates anticholinergic. You see how you do selected apply? You don't have to go from top, bottom, back. Attack each question one at a time. Don't do yes or no. No, just like use your concept. Myasthenia gravis, what does he need? Cholinergic. And if I give you anticholinergic, you're not going to like it. Sjogren syndrome, what do they need? They're always dry. Their eyes is dry. They can't salivate. The vagina, if it's a female, is dry. They get constipation. Things are all dry. Do you want to give them anticholinergic? They're not going to be happy. Prostate people, what is the side of effect of cholinergic, anticholinergic? Urinary retention. BPH people, you want them to have urinary retention? They will say, no, I hate you. I want to pee. If you give them anticholinergic, they're not going to be happy. I just give you the answer for the asthma patient. Asthma, what is one of the medications you give them in acute asthma? You give them oxygen, you give them steroid, you give them bronchodilator. And one of the bronchodilator, after bronchodilator, you give them anticholinergic, which is what? Anticholinergic, what does it do? It causes bronchodilation. Therefore, asthma patient would love trimethoprim. Say, yeah, give it to me, bring it to me, because it will dilate my bronchus. It's not going to cause constriction because it's an anticholinergic. If it's a cholinergic, it's going to constrict me. Therefore, asthma will love it. Glaucoma patient is not going to talk to you anymore. When you give a glaucoma patient anticholinergic, you dilate your people, they can have acute glaucoma problem, and they're not going to be happy with you. So select or apply. Which one the nurse is supposed to question is all based on one word: anticholinergic, any side effect. You see, nothing to the question. It's 3 lines, but if you pick the buzzword and you work with the buzzword, I'm just using one word, one at a time. Anticholinergic. So your right answer is 1, 2, 3, and 5. You don't have to pick all of them. If you know it, you pick it. But if you don't, just let it go. That's the select or apply. You're not going to lose the point, but make sure the one you pick, you understand it. I never compare any answers. I never go from left and right. I just attack each answer choice one by one using the fact that which of these disease process does not like anticholinergic. And that is what the question is asking you. Try to figure out the key concept of the question. The whole question is about side effect of trimethoprim, which is DANS, and the one of them is anticholinergic. The nurse is supposed to question based on the history. If you see any of these medical problems that does not like anticholinergic, that's your answer. That's all. Nothing to trap you. So 1, 2, 3, and 5 are your right answer. 2 questions. Test taking strategy. As you prepare for your NCLEX, I want you to master the thing. You have to master how to answer questions. After you've studied, try to come up ways you want to attack questions and make it your own and make it easy so that you become comfortable when you see, no matter how long the question is, you just say, bring it on. I can do this. Break the question down, find the keywords, write it down, find the concept underlying the question, and use it to look at the answer choice. You'll be fine. I know you guys been studying hard, but you got to get yourself in shape and figure out where your weakness. If question answering is your problem, try to attack it. Thanks for watching.